Caitlin, a student nurse, is going to teach Carrie and her mom, Mrs. Rubel, how to draw blood using a lancet so she can check her blood sugars in her glucometer. Caitlin's goal is to increase the Rubel family's knowledge on lifestyle choices to mediate diabetes and related skills for testing blood sugar. And here are the objectives, but we'll cross them off as we encounter them. Oh, they're starting! Let's watch!
Carrie, hello Mrs. Rubel. I'm Caitlin, I'm a student nurse here. How are you today? Good. Great. Perfect. Before we start, can I offer you anything to drink, coffee or juice?
See how Caitlin chooses a quiet room as setting for the education plan? How smart of her! This will provide less distraction. She also introduces herself and builds a rapport with the client.
Oh no thank you, we just had lunch. So I read on your chart, you're here to learn about diabetes and how to use your glucometer. What do you already know about the glucometer?
Caitlin is determining the readiness of the learner. Carrie is physically ready in a comfortable setting. She's emotionally ready and wants to learn about her diabetes. Her mother is there for support, since she's only 10 years old. As for knowledge readiness, this is why Caitlin is asking what Carrie already knows about the glucometer. This also empowers Carrie.
It's the machine I'll be using to take some blood and I think measure how high and low my blood sugar is.
Perfect, that's right. So this machine here, it's called the glucometer, and like you said, it's used to check if your blood sugars are high or low. Okay, so I'm going to take out the glucometer now, and we're going to go over the parts. So this is the glucometer. This is the test strip, and it goes in the top of the glucometer with the window facing out. And this is the lancet that you use to prick your finger.
So this is the glucometer, this is the test strip, and this is the pricky thing. Lancet, I think?
Yay! Carrie has successfully identified the glucometer and its parts. We can cross that off.
First step, let's go wash our hands. Okay, now that our hands are washed, we're going to get the lancet and I'm going to show you how to prick up your finger and drop the blood. So you're going to take the lancet and remove the cap. And then next, you're going to press it against your finger towards the side and squeeze until you hear a click. Okay, so now you're going to gently squeeze your finger until enough blood comes out to fill up the window on the test strip. You can also prick the palm of your hand and your forearms, but today we're just going to stick to your finger. Maybe we can have Mom prick her finger first to show you what it's like.
School-age children seek independence, yet they also still want support from their parents. Caitlin is asking Mrs. Rubel to do it first in order to reduce Carrie's anxiety.
Would you be okay with doing this? Yep. Okay. So I'm going to hand you this. Okay, so let's watch Mom do it. Twist off. And then take the blood and put it on this little strip right here. Just like this? Yeah, and just make sure it all fills up in the window. There you go. We'll take the strip and we'll put it into the glucometer. And it's going to count down from 5 as it reads your blood, and once you reach 0, you will have your blood sugar reading. Easy as pie, right? Do you want me to show you again, or do you want to try it, Carrie?
I can try.
Okay.
So I'm going to take the lancet, I'm going to take the cap off, and then I'm going to put this on the side of my finger, and then press down and wait for the click. And then squeeze the blood and take my test strip and then fill the window with the blood. make sure it's filled, and then I'm going to put it in the glucometer because it's already on, and then wait 5 seconds. Beep! And then it says my reading.
Wow, Carrie did such a good job. She demonstrated proper technique for lancing her finger and drawing out blood for the glucometer.
So does everything make sense so far?
Yep, I think so.
Alright, tell me if you have any questions before we go on.
And do you remember the signs that we talked about, Carrie, that would mean you have low or high blood sugar?
I kind of forget them.
So Carrie, if you find you're forgetting them and you need to find a way to remember them more easily, what is your favorite class in school?
Here, Caitlin is determining what type of learner Carrie is. This will enable Caitlin to help Carrie remember the more difficult portions.
Definitely arts and crafts.
So what you're saying is you use drawing to learn?
Wow, was that the listening skill paraphrasing? This Caitlin, she's good.
Well, that's great. Maybe you can use drawing pictures to better remember them.
Yeah, I could. And then I could maybe put it in my desk at school to help me remember.
That's a really good idea. So we're just going to go over some of the symptoms of hypo and hyperglycemia together. For hyperglycemia, which is a blood sugar reading of 7 or higher, some of the symptoms are extreme thirst, dry skin, hunger, blurry vision, drowsiness, and you may need to pee often. For signs of hypoglycemia, which is a low blood sugar reading of 4 or lower, some of the symptoms are shakiness, fast heartbeat, sweating, dizzy, hungry, blurry vision, weakness or fatigue, headache, and you may have irritability. So if you're feeling dizzy, this could mean that your blood sugars is low, which would mean that you have a blood sugar reading of
4.
Yes, perfect. They're under 4. Do you know what to do to get them back up?
I can drink the orange juice in my lunchbox, or I can have 3 or 4 hard candies.
Yeah, you're doing awesome. So if you're feeling extreme thirst, this is a sign of hyperglycemia. And if you test your blood sugars, they should be over
7.
That's right, it will be over 7. And if that does happen, you should go see the school nurse or your mom.
Carrie just identified the possibilities of blood sugar level interpretations, and she also identified the actions to take in case of hyperglycemia. We can cross those off.
Now, Carrie, can you tell me what you like to do? Do you like skipping rope, playing outside, ballet?
I love playing sports and being outside, but I tend to watch a fair amount of TV.
Only 4 shows a day.
Okay, well that's great. You like to play sports and be outside, and you only watch 4 shows a day, which isn't bad at all. Right, Mom?
Right.
Maybe you could get your parents and friends to come and play road hockey with you also.
Yeah, that'd be fun. I love when my dad's a goalie and I get to shoot pucks at him and score.
I bet you have a great shot. What about eating? What kind of foods do you like to eat?
Well, I love fruits and salads, but I do eat a lot of cookies. They're just so good.
And guess what? It's okay to have some cookies, as long as you eat your fruits and veggies too to stay strong. And for Mom, I have some resources like the Canada Food Guide to help you identify what foods to eat every day. And I can also set up an appointment with a nutritionist if you would like to help answer any more questions.
Oh, that would be lovely.
Here, Caitlin made sure that the family understood the guidelines for healthy eating. She also offered Mom extra resources if they needed it. Caitlin also ensured that Carrie maintained the minimum 30 minutes a day of physical activity that will help prevent any complications from her diabetes.
Great, well that covers mostly everything today. Did you guys have any questions?
No, I think we got it.
Yeah.
Great, and how did I do? Did I do a good job teaching everything? Was it too complicated?
A+. There was a lot of information. Is it going to be like written down somewhere in case I forget?
Well, here are some pamphlets that you can use to read over with your mom if you would like. And if you have any questions, you can call the numbers on the back for further information. Now, Carrie, how do you feel about managing your diabetes?
With the calendars and the drawing I'm going to make when I get home, I think I'll be just fine.
Last but not least, Caitlin made sure that Carrie was emotionally ready and didn't have any concerns about monitoring her own glucose. What a good nurse.
And how about you, Mrs. Rubel? Do you have any concerns? We do have programs that help subsidize the purchase of additional supplies.
Oh no, that's fine. We have coverage for everything through my work.
Perfect then. Okay, well good luck, Carrie, and feel free to contact me if you have any more questions.
Thanks for watching. The end.